Dr. Suman Singh, Senior Obstetrician and Gynecologist at BirthRight, Rainbow Hospital, Bannerghatta Road. Today I'll be talking about hypertension in pregnancy. Hypertension or increased BP can happen sometimes in women during pregnancy. In fact, in India it is one of the leading causes of maternal deaths. Now it is important for us to identify women who are at risk of getting BP so that we can take corrective measures beforehand in order to reduce the complications in these women. So what do we do for this? Nowadays, in the 3rd month of pregnancy, that's around the 12th week during the NT scanning, we can do what are called as uterine artery Doppler screenings and a first trimester quadruple test, which will be able to predict well in advance who are the women who are going to be prone for getting BP in pregnancy. Once we are able to identify these women, then we can start taking corrective measures well in time. So what do we do in these women? We are able to give a tablet called ecosprin in these women, and this is almost like a magic pill. It is able to reduce the chance of BP itself in most women, and if at all somebody gets BP, it will help to reduce the complications with regard to BP. So therefore, we can predict in advance and we can prevent. Now what happens if somebody gets BP? A lot of women are hesitant to take medicines for blood pressure in pregnancy because they think that they will have to take it for life. But that's a misconception. BP in pregnancy typically comes down to normal after delivery. So they need not fear, but they must understand the importance of taking these medicines, because if it's not under control, there can be a lot of complications, some of them even life-threatening. There are women who come with complications like eclampsia, where they throw convulsions. They can have problems in the liver. The liver enzymes can increase. They can have low platelet counts and they can have bleeding disorders. And there can be so many other complications because of the uncontrolled BP. So therefore, BP control is mandatory and it's not necessary to continue these medicines after delivery, of course, based on the doctor's advice. So don't be scared, take your medicines and avoid the complications.